It's absolutely crucial. I mean, obviously the NHS, the budgets are all under a lot of pressure at the moment, and we've got to do things like reduce length of stay in the hospital. We've got to make sure we deliver the right treatment as soon as we can to patients, and the only way we're going to do this is if we can actually start to see and share the patient pathway right across from the GP through the hospital and then back out into the community services. So it's going to have to be key in helping all the NHS make the efficiency savings that we need to do. Certainly from the organisation, not only will it mean that we should be able to make significant financial savings, it does mean from the clinicians that they will be able to know that they're giving safe patient care. Quite often, correspondence is delayed or case notes get missed and lost, and clinicians don't always have the information they need when they see the patients, and so sometimes they're having tests redone which they've already may have the results for, but they're missing. So being able to have an electronic view about what's happened to a patient and looking at the previous history is going to enable clinicians to make the right decisions and to make hopefully a lot sooner as well. Now from the patient, that means that they shouldn't have wasted trips to hospitals for appointments. It also means that particularly if they've had a test result and they're not sure about it, if we can share that with our GP colleagues, it means that doctors and patients can look at things together. Quite often patients come to the hospital and they don't always take on board what the clinicians say to them, and they like to go back to their own GPs and be able to have access to what information the hospital doctors have seen. It means that the GPs can have a really meaningful conversation with the patients. And again, if they get discharged to community care, if the community staff can see what the hospital information is, again it makes sure that they're delivering the right care for the patient. So it's got to be good for patient care, and also putting knowledge and control into patients' hands. The hospital that I work at is actually made up of 4 hospitals over 5 sites, and it is very large, and that brings its challenges, and we're actually going through a lot of reconfiguration at the moment, trying to improve the way we deliver service. So it may mean that a patient goes to one site for an outpatient appointment but to another site for their operation, for example. And we've got to make sure we've got that information available. So to me, having an electronic patient record is going to be absolutely key to improving communication right across the organisation, and it is also going to be very important in terms of the patients, because they know then when they come for an operation or an outpatient appointment, the doctor has got the information there to treat them safely. We're looking not just into removing paper at the hospital. The vision is that we will go paper light, and over the course of the next 3 to 4 years we're looking to introducing the electronic capture of patient information, whether that's by using keyboards and clinicians keying in directly, or whether it's using digital dictation, using technology to help capture that information and make it available instantly to other colleagues. There's many different clinical groups involved in a patient's care in a hospital, so it's important that, for example, the allied health professionals, the physios, can see the same information that the doctor's seen, and then when they get moved on into the community, they're seeing the same information. So the vision for the hospital is, by using technology, to be going very paper light as much as we can, and where we can't remove paper, or while it's taking us time to generate forms and things to capture the information electronically, we will at least start to scan the paper and build that into the paper records. So the Trust has got a very clear vision as to where we're going, and I feel very much that it supports not just safe patient care, but it's very important, it will help us to provide the clinical 5 that we're expected to do, and it will also very much help to support the white paper that's recently come out from the Department of Health. Certainly moving towards having electronic systems and having systems that can be shared across the community, I think it's going to be very important and help us to build a lot stronger relationship with our GP colleagues. I actually went to what we call a clinical liaison group, where the hospital gets together with local GPs. I think we get together about once a month, and I went down to them explaining the things that we were hoping to do with the IT, and they were absolutely thrilled to bits, because they can see that the hospital is happy to share the information, and particularly they could see the benefits for them in trying to talk to talking to their patients. And I think that's really going to help both the hospitals and the GP in this new world develop very strong relationships. You know, the GP can come in and look at any of his patients' records and might happen to be an inpatient. You know, that's got to be a good thing. Again, when the patient comes home, they can actually look at the records where, you know, either in the surgery, or if they want, they could actually use a laptop and take it to the patient's home and actually come in and look at the records again with the patients, whether if they're not well enough to actually visit the practice. So I can only see it being a very good thing, not just in terms of patient safety, but also in terms of building relationships in this new world.